Hi everyone. Today in this video we are going to discuss about Solifenacin. What is this drug Solifenacin? The suffix phenacin indicates that this drug is an anticholinergic agent. We have another drug with similar suffix such as darifenacin, which is selective for M3 receptors. Similarly, other drugs such as oxybutynin, tolterodine, trospium chloride, all these are the anticholinergic agents which are selective for bladder, so they can act as bladder relaxants. So today in this video we are going to discuss about this solifenacin, how this drug acts, what is the mechanism of action, what is its chemical nature, important precautions, side effects, doses, all these things we will discuss in this video. In the conditions such as overactive bladder, where the bladder is more constricting, resulting in the increased urinary frequency and increased urinary urgency, resulting in urinary incontinence, in such conditions solifenacin can be used to reduce the activity of the bladder by producing the bladder relaxation. As an anticholinergic agent, solifenacin can produce various side effects. It can produce blurred vision because it can reduce the ocular secretions. It can produce constipation because it reduces the gastric motility. Can produce dry mouth because of decreased salivary secretion. It can reduce the urinary flow, resulting in urinary retention. So these are the common effects produced by solifenacin, which can be remembered as BCDU. B is the blurred vision, C constipation, D dry mouth, and U urinary retention. Now let us see the chemical nature of this drug. This is the structure of solifenacin. Here we can observe one of the heterocyclic ring system. This is nothing but isoquinoline, which is a dihydroisoquinoline. And here another bicyclic ring system is present. This is nothing but the quinoquinidine. Now this quinoquinidine is attached to the isoquinoline through an ester bridge. So this structure is somewhat similar to the natural anticholinergic agents such as tropane alkaloids. So solifenacin is a isoquinoline ester with quinoquinidine nucleus. Now let us see how this drug acts. On the bladder, two types of muscarinic receptors are present. One is the M2 receptors and second one is the M3 receptors. M2 receptors are abundant, so they are major receptors expressed, whereas M3 receptors are the minor receptors expressed on the bladder. But here the contraction of bladder is mainly mediated by M3 receptors, so M3 receptors are responsible for bladder contraction. And M2 receptors can facilitate the action of M3 receptors so that they can increase the contraction of the bladder by facilitating the M3 receptors. Now, solifenacin can block these M2 receptors as well as M3 receptors so that it can produce bladder relaxation. So, on the bladder, M3 receptors are present, which are G protein coupled receptors. Now, acetylcholine can act on these M3 receptors. When acetylcholine binds to these M3 receptors, they can activate phospholipase C system. This phospholipase C is a cleavage enzyme which can cleave the phosphatidyl inositol biphosphate PIP2 into two fragments. One is IP3 inositol triphosphate and second one is DAG, diacyl glycerol. Now this IP3 can release the intracellular calciums from the sarcoplasmic reticulum. It can bind to the IP3 receptors so that calcium can be released into the cytoplasm. Similarly, another fragment DAG can activate the protein kinase C enzymes, which are again the phospholytic enzymes responsible for opening of inward going calcium channels. Now calcium can more enter into the cell. In this way the intracellular calcium levels are increased, which results in the contraction of the smooth muscle. In this way acetylcholine can produce bladder contraction. Now, solifenacin acts as anticholinergic agent. It can block the M3 receptors so that it can prevent the contraction, resulting in the bladder relaxation. What are the precautions of this drug? Solifenacin should be carefully given because it can act on the CNS and it can produce some somnolence in the patients. So, the patient may have some impaired driving performance or working with machinery. And this drug can also produce some central side effects such as headache, confusion, hallucinations. Particularly these side effects are observed at high dose of the solifenacin. Similarly, this drug can block the M3 receptors within the colon so that it can reduce the gastric motility. That's why this drug produce constipation as one of the important side effects. So this drug should be carefully given in the patients who are having any gastric retention or decreased gastric motility, because this drug can further impair the conditions by reducing the gastric motility. Similarly, this drug can block the M3 receptors located on bladder so that it can produce bladder relaxation. And when the bladder is going to be relaxed, it can reduce the urinary output, resulting in the urinary retention. So since this drug is used for urinary incontinence, it can produce urinary retention at higher doses. Another important precaution of this drug is that this drug can produce anaphylaxis, resulting in angioedema. So it can produce swelling of lips, tongue, glottis, larynx. Even it can produce tightening of the throat. So any of these symptoms should be carefully monitored in the patients that may be produced by solifenacin. Similarly, this drug can affect the eye, where it can produce a pupillary dilatation, resulting in the increased intraocular pressure. So this may increase the risk of glaucoma. That's why this drug should be carefully given in the patients with narrow angle glaucoma. Similarly, this drug can increase the QT interval, particularly at very high doses such as 30 mg. So it can increase the QT interval and it can precipitate Torsades de Pointes. At therapeutic dose, even this side effect is not observed. But in the patients with any risk of increased QT interval, in such patients, this drug should be carefully given. What are the side effects? The important side effects of this drug mainly include blurred vision, constipation, dry mouth, and urinary retention, commonly known as anticholinergic side effects, which can be remembered as BCDU. Similarly, this drug can produce some dizziness, nausea, some dyspepsia, somnolence, dry eyes because it reduces secretions. Angioedema can be observed with this solifenacin. How it is given? This drug is available as tablets at a strength of 5 mg as well as 10 mg. The initial dose of the drug is started at low dose such as 5 mg, and the dose can be increased up to the 10 mg based on the efficacy of the treatment, but it should be always started at low dose, and in the patients with any renal impairment, the dose may be reduced in order to avoid any significant adverse effects of this drug. So that's about this drug solifenacin, which is a anticholinergic agent that selectively acts on the bladder so that it can produce bladder relaxation. Thereby it can reduce the urinary frequency, urgency, and even urinary incontinence. But at the same time, it can produce urinary retention because of relaxation of bladder smooth muscle. As an anticholinergic agent, this drug can increase the risk of glaucoma. It can reduce the gastric motility, leading to constipation. And even it can produce some anaphylaxis, resulting in angioedema. And even it can act on the central nervous system, resulting in some somnolence, sleepiness in the patients. All these precautions should be considered when this drug is going to be prescribed. So that's about this drug solifenacin. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.